Stop giving people the diagnosis of depression. Depression is a symptom cluster. It shouldn't be a diagnosis. I want to get into all those strategies. But let's talk a little bit about what's driving this. But that he was just reflecting what society believes, that you're weak if you have a mental health problems. I'm overweight because my family's overweight. Or I have hypertension because it runs in my family. Or I have diabetes because it runs in my family. Or I have Alzheimer's disease, or I'm vulnerable to it, and there's nothing I can do about it. And that's aliagenas increase your vulnerability, and they teach you what you should be doing. So for example, I have 6 children, 3 of them are adopted, 2 of my nieces were adopted because their parents couldn't stop with drugs and alcohol, and it was a disaster for these kids. And I tell my nieces, if you never drink or drugs, you're never going to have a problem, but if you do, it could be serious. You need to be on an alcohol drug prevention program every day of your life. I have obesity and heart disease in my family. I'm going to be 70 this year. I'm not overweight, and I don't have heart disease because I'm an obesity heart disease prevention program every day of my life. So if you have it in your family, as soon as you should be serious about preventing these 11 major risk factors. I want to get into all those strategies, but let's talk a little bit about what's driving this, what is causing this. I would imagine a portion of the spike that we're seeing, this increase in incidence, is related to the fact that people are living long and baby boomers are aging up. But also I suspect that lifestyle habits are contributing to this as well, with the increase in type 2 diabetes, obesity, hypertension, and the likes. So what's causing cognitive decline, or seriously unhealthy lifestyle and undisciplined minds did? Depression doubles the risk of Alzheimer's in women and quadruples in men. What is the relationship between depression and dementias? So many people think if you're an older person and you get depressed, it's actually a precursor to dementia. They're both brain diseases or brain problems, if you will, and it's critical in the men bright minds mental health stew. Got so excited about this because what I came to realize is started looking at the brain in 1991, and we've looked at over 250,000 scans, but early on I came to realize you're not stuck with the brain, you can make it better, and I can prove it. And so if I look at your brain and then you have a car accident, your brain's going to be worse. If I look at your brain and then you goon a drug bender, your brain is going to be worse. If I look at your brain and then you all of a sudden you stop sleeping or you got through a divorce, odds are your brains go into change in a negative way. But I also did the big NFL study when the NFL was sort of lying. They had a problem with traumatic brain injury in football. 80% of my players got better, so 45 years ago. I fell in love with psychiatry and I've loved it every day since. But I fell in love with the only medical specialty that never looks at the organ it treats, and I knew it was wrong and I knew it would change, I just no idea it'd be part of it. 1991, I'm now a psychiatrist for about a decade, and I went to a lecture at my local hospital on brain spec, imaging single photon emission computed tomography. It's a nuclear medicine study that looks at blood flow and activity. It looks at how your brain works, and it basically shows us 3 things: healthy activity, too little activity, or too much. So what we do is we take a radiopharmaceuticals. You take a radioisotope. We take one we use is called technum, and technum has self-esteem problems. It doesn't like being who it is, and it changes shape, and when it changes shape, it produces a photoneural little packet of light that we can measure. So a combined technician with MPA or medicine that's easily taken up by cells in the brain, combine them, inject them into your arm, and it's called a first pass extractions. So 70% of it's taken up in your brain in that first pass, or within about 2 minutes, and then so shard is part of the little tinny needle into a vein in your arm, inject the medicine, it lights up your brain, and then we can measure it, have you lay on a camera table. So this was sort of an inciting incident that allowed you to see the benefits of using this as a diagnostic tool. This imaging technology, I like it when my patients get better, so I went into psychiatry and it was totally personal for me and I loved it, but I was already getting criticism from it. It's like, oh, we don't do this, it's not standard, it's not what we do. But 1999 2 all-day seminar at the American Psychiatric Association brand spect imaging in child psychiatry, because I'm also a psychiatrist and I'm so excited because I'm meeting colleagues who do it. And in 1993 I teach with that group, so I'm like all in on the technology. But it will S1T93 lots of pushback from the American Psychiatric Association because it doesn't fit the current diagnostic paradigm. It's like, stop giving people the diagnosis of depression. Depression is a symptom cluster. It shouldn't be a diagnosis, sort of like chest pain is a symptom. So if you think about it, this collinear Sandy Hook or Parkland, Florida waiting to happen. And I'm like, I want to see him tomorrow, and they lived 8 hours from mess, so they brought them to me. I'm like, buddy, what's going on? And he's like, Uncle Danny is mad all the time, like is anybody here? Rarting you noise anybody teasing. Is anybody touching you in places that shouldn't be touching you? 999 child psychiatrists out of a thousand would put him on medicine and therapy. And because of my experience, I already scanned 1,000 people at that point. I'm like, he's got a left temporal lobe problem. And so I'm like, I held his hand while he held his dead bear and got scanned, and he was missing the function of his left temporal lobe. I'd never seen it. I've seen it 100 times since then. Turned out they had a cyst the size of a golf ball occupying this pace of his left temporal lobing. I told his pediatrician, Ed, you find somebody to take it out, because he wasn't in my neighborhood, and he talked to 3 neurologists. All of them said they wouldn't touch the cyst until he had real symptoms, at which point I lost my mind and start screaming at the pediatrician of a homicidal, suicidal child who attacks people for no reason. What do you mean real symptoms? And he got anxious, and he said, I think they mean like seizures or loses consciousness. I'm like, serious? And in my head, I'm like, neurologists, neurosurgeons. Neurosurgeons will do stuff. So I called UCLA, talked to the head of the pediatric neurosurgery department, Jor Laura, and he said, Draman, when these cysts are symptomatic, we drain them. He's obviously symptomatic, and after the surgery, I got a call from my sister-in-law, who said the surgery went really well. And when Andrew woke up, he smiled at her. She said, Danny, he's not smiled for a year. And then I got a call from Dr. Laser, who said, oh my God, Draman, that cyst was so aggressive that put so much pressure on Andrew's brain that thinned the bone over his left temporal loso. His skull had been thinned. He said if he would have been hit in the head with the basketball, it would have killed him instantly. Either way, it would have been dead in 6 months. That's an amazing story. What's so interesting is the idea that our personalities are not static, that something amiss with the brain could completely change a person's outlook on life, how they show up in the world, the thoughts that they're entertaining. And within case of that example, like a simple procedure, not a simple procedure, but a procedure could completely change that good or bad, right? Kangaway, Butte after Andrew, and it's now 30 years later, 29 years later. Andrew's married, has 2 children, has his own business. He's normal, and it was that moment I lost my anxiety and my need for Utolic meth. That's when the war began to try to change psychiatry to become, it's like, come on, we need to get into the 21st century. In 1979, when I told my dad I wanted to be a psychiatrist, he asked me why I didn't want to be a real doctor. Yeah, he wasn't happy about why I wanted to be a nut doctor and hang out with nuts all day long, but that he just was. Just reflecting what society believes, that you're weak if you have a mental health problems, you're bad if you have a behavioral problem. And the images clearly taught me free will is not 0 or 100, that's free will is gray. And I ended up testifying in some death penalty cases. One of my favorite stories is Adriana, who I just dearly love, normal 16-year-old beautiful ghost to Eid. They think it's a magic moment when they're surrounded by 6 deer. 10 days later, she becomes aggressive. She starts to hallucinate. She's paranoid. She's hospit. Eli's given a diagnosis of schizophrenia, and after 3 hospitalizations, multiple medications, the family spent $100,000. Adriana is a shell. She comes to our clinic. She's one of our doctors. Her brain's on fire. Why is her brain on fire? We see inflammation. Turned out she had Lyme disease on an antibiotic within a year. She's normal. She graduated from Pepperdine. She's got a master's degree from the University of London. She's normal. They think infectious disease and talk about COBA because it's part of it, is a major cause of psychiatric problems, and nobody knows about it because people aren't looking at the brain. And so you ask, what are sort of the big lessons I've learned? Mild traumatic brain injuries, a major cause of psychiatric illness. And nobody knows it because they don't work for